K. Aarti, Senior Resident in Gandhi Medical College. Today my topic is clinico-epidemiological profile of COVID-associated mucormycosis patients in a tertiary care center. Introduction. Next slide. Introduction. Mucormycosis is an invasive fungal infection caused by fungi belonging to family Mucorrhaceae. Rhinocerebral mucormycosis is the most important clinical presentation of mucormycosis. It's an emergency surge in COVID. It became an emergency surge in COVID-19 pandemic second wave in India. Severe COVID-19 is associated with significant incidence of ROCM with high mortality rates due to dysregulation of the immune system and widespread use of corticosteroids. So physicians should be aware of the possibility of the co-infection in COVID-19 patients. So an aggressive multidisciplinary approach is life-saving for the patient. The diagnosis is often made late and relies on the anatomical, pathological, and mycological examinations. So early management and appropriate medical management are vital to save the life of the patient. So in the present study, we have presented 101 cases of COVID-associated mucormycosis with their clinical history, clinical features, conventional cultural results. Aims and objectives. Our aim is to delineate clinical epidemiological profile of COVID-19 associated mucormycosis patients in a tertiary care hospital. Objectives is to study clinical epidemiological mycological profile of COVID-19 associated mucormycosis patients and to identify the causes and risk factors, to analyze symptoms, complications of COVID-19 associated mucormycosis. Study design is a descriptive prospective observational study. Materials and methods. The structured patient pro forma was prepared and the history symptoms related to COVID treatment received were collected. The patient samples, the biopsy samples were received at microbiology laboratory were analyzed by performing KOH and tissue specimens were inoculated on SDA and DRBC agar plates. The results were noted systematically. Coming to the results, we have 101 patients with 75 males and 26 females. So we have male preponderance and all the patients are associated with COVID except 2 patients. And coming to the treatment on the steroids, we have 71 patients are on the steroids and 31 patients didn't take any steroidal treatment. And coming to the diabetes, we have 58 patients with chronic diabetes and 48 patients got diabetic de novo after taking treatment with COVID. And 59 patients had used cloth masks, of which 39 patients washed them daily. And N95 for more than 1 day by 2 patients. N95 masks used for more than 1 day by 2 patients. And coming to the clinical symptoms associated with COVID-19 are, these are the symptoms that are associated. These are loss of vision seen in 24 patients, periorbital edema in 64, facial pain in 56 patients, loss of eye movements in 16 patients, necrosis of heart palate in 14 patients. And coming to the KOH mount results, we have broad septate hyphae seen in 83 patients, narrow septate hyphae in 8 patients. These were isolated in 3 patients. And KOH positive culture negative in 28 patients, and no fungal elements were seen in 7 patients. And conventional cultural results. These are the isolates that are seen in conventional culture. Here, Rhizopus was isolated in 43 patients. Aspergillus species were isolated in 8 patients, Aspergillus flavus in 3, fumigatus in 3 patients, Niger in 2 patients, Candida species was isolated in 3 patients, Demeticious fungi in 1 patient, and no fungal growth was seen in 40 patients, and negative for both culture and KOH, 6 patients. This is a bar diagram showing the isolates and the relevant picture. And sensitivity of KOH and culture. Sorry. KH positive culture negative in 23 patients, KH positive culture positive in 55 patients, KH negative culture positive in 6 patients, KH negative culture negative, both are negative in 0 patients. That is, we got either KH or culture positive, but neither of them negative, 0 patients. Coming to the discussion, there are many complex factors that are related to the COVID, like pre-existing diseases like diabetes mellitus, use of immunosuppressive therapy, sorry, and systemic immune alterations in COVID-19 leads to secondary infections. The immune dysregulation associated with COVID-19 with reduced number of T lymphocytes, CD4T and CD8T may alter the innate immunity. The sample size sample size of the present study is 101. 101. It is not relating with any other studies because in other studies we have only less number of patients are taken in the as a sample size. But the mean age of the present study is 47.9. It is relating with the studies like Saroj Gupta et al., Bhopal, India, whose mean age is 46.8. The risk factors associated with COVID-19, risk factors associated with COVID-associated mucormycosis are the usage of corticosteroids, long-standing diabetes. It is correlating with the many studies like Saroj Gupta et al., Bhopal, and Bayram et al., Turkey, Fazeli et al., Iran. Treatment guidelines for the COVID-19 patients. Current guidelines in India recommend intravenous use of methylprednisolone 0.5 to 1 mg per kg per day for 3 days in moderate cases and 1 to 2 mg per kg per day in severe cases. The NIH recommends the use of dexamethasone 6 mg per day for a maximum 10 days in patients who are ventilated or require supplemental oxygen, but not in milder cases. The guidelines specifically mention the risk of developing a secondary infection. Coming to the conclusion, COVID-19 infection increase the risk of mucormycosis, and usage of corticosteroids and diabetes mellitus are the most important predisposing factors in the development of COVID-19 associated ROCM. Thank you.